Good evening, madam. Unmute your mic, madam.
Good evening, sir. Very good evening.
Oh, nice. By the grace of God, today there is no problem. It is
Yes,
audible.
yes,
You are audible. I am also audible, na, madam.
yes, you are audible.
Okay. Wait for 2-3 minutes. Let others join,
Yeah, sure.
and you
Sir,
can
we
start
start
with.
the session from the question answer sessions.
Yeah.
Okay,
Only two three students are there, na. Or shall we start?
let's other join, I guess.
Okay. Wait for 2-3 minutes and then start. First,
Okay,
yesterday session, doubt clarification. Then finally go ahead with interactive method.
okay.
Madam, please start the session, madam.
Okay. Shall I start with my presentation or they are going to ask the questions?
I will request the students to ask the questions whatever yesterday you could not ask because of connectivity problem. Okay. Today you can ask the questions and then madam will start today's presentation. Over to students. Okay, madam. Then today you start your presentation.
Okay, sir.
Okay.
I'm just sharing my screen. Just let
Yeah.
me know if you're able
Yeah.
to
I will
see
tell you.
the presentation or not.
Yes, presentation is opening, madam. Can you
Okay.
do it for the full screen mode so that
Yeah, I'm presenting. Just wait for a second.
yeah.
You all are able to see my screen?
Yes, madam. Now it is okay.
Okay, as I introduce myself, students, I am Dr. Himanshi Rathore, and today we will be continuing with our Unit 4, 5, and 6. Yesterday we covered Unit 1 to 3 of the course Certificate in Food and Nutrition. So today we are going to start with Unit 4, which is micronutrients and their function. As you were asking me, what are micronutrients, what all are macronutrients, I guess the students are not there to question me, so I am again starting with this. And after reading After studying this unit, you all will be able to tell me the function and importance of all the micronutrients and list their important food sources, in which food sources the different nutrients are available, and they describe their deficiency. That if you will not consume them in appropriate amount, what will happen to your body. So now let's start with first vitamins. So vitamins are nutrients which are important for good health, as you all know. Our body cannot synthesize them, hence we have to take them from outsource. We have to outsource these from other food sources, and vitamins are divided in two groups. As I told you yesterday also, there are water soluble vitamins and there are fat soluble vitamins. Water soluble vitamins are vitamin B group, under which B1, B2, B3, B6, B12, they all comes, and the second vitamin which is water soluble is vitamin C. And as I discussed with you yesterday, we have four vitamins which comes under the category of fat soluble, and they are vitamin A, D, E and K. Why they are fat soluble? Because for their absorption in our body, they require fat. Their absorption cannot. Hello, am I audible to all of you?
Yes. 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 Yes.
Okay,
Yes, ma'am, you are audible.
sorry for the disturbance. So they require fat uh, for their absorption in our body, and that is why they are called as fat soluble. And why water soluble? We are calling them water soluble. They are soluble in water. And fat soluble vitamins are not soluble in water, they are immiscible in water. They form droplets in the when we dissolve in water, so they are fat soluble. They dissolve in fat, and water soluble dissolve in water. So these are the two groups in which vitamins are divided. Now we are moving on to the vitamin A, which is fat soluble. So we are starting with the fat soluble vitamins first. What are fat soluble vitamins? How they are being absorbed in our body? In which food products they are available? And what happens if we are not having the sufficient amount of these vitamins? We will be discussing or covering all these things in these slides. Okay. Now, vitamin A is also called as retinol and beta carotene because they contains retinol and beta carotene. What is retinol and beta carotene? Retinol is the pure vitamin A and it is only found in animal foods like meat, egg. Okay, they are found in animal foods which are being produced by the animals. And beta carotene form of vitamin A is provitamin A. They are first converted to vitamin A before being absorbed in the body. Okay, they have to be converted into the retinol only, and they are present in vegetarian sources. Vitamin A beta carotene is present in plant sources, and which food groups are there, we will be discussing it later. But I'm telling you that carrots are the uh, beta carotene rich food source because they are red in color. They contains vitamin A, but in which form? In beta carotene form, and beta carotene form cannot be absorbed by the body as such. First, it has to be converted to the vitamin A, that is retinol. They have to be break down into the retinol, and then only the body can absorb these. Eight parts of beta carotene. If you are consuming carrots, then eight parts of beta carotene would be converted to one part of retinol. This you have to keep remember that how many parts of beta carotene are required to convert into one part of retinol. So eight parts of beta carotene. Okay, I guess this is clear to all. Now moving forward,
Madam, someone is
here,
raising his hand. You may kindly call him. Al Hassan Abdullah. You may ask your question.
okay, uh,
Al Hassan. Please unmute your mic and ask your question. Or else you type your question in the chat box.
There is no question, I guess, in the chat box.
Okay, he is telling that he is not able to listen, but that complaint is not there from any other student. So we can
Yes.
continue, madam.
Okay. So, as I am telling you, the vitamin A has two forms, retinol and beta carotene. This is clear to everyone. And beta carotene is found in plant sources and retinol is found in animal sources. These are the food sources of vitamin A. Generally, the fruits and vegetable which are in orange color or red color, they are called as a vitamin rich fruits like mangoes, papaya, melon. They are orange in color and they contains beta carotene in good amount. Then carrots are also a very good source of vitamin A, but fish and eggs, they contain retinol form of vitamin A. Hence, the plant sources contains vitamin A, but they are in beta carotene form and they require to break down into the retinol. So, it is always better to consume non-vegetarian sources of vitamin A because they are well absorbed and retinol is immediately available for the body to be being absorbed. Okay, this is the slide you can see, which is um, telling you about the food sources of vitamin A. Now moving forward, here is the slide which is showing the functions of vitamin A. Why we need vitamin A? Because it is important for our eyes. I discussed this yesterday also that if you are not consuming right amount of vitamin A, your vision will be compromised. So for a normal vision, for healthy vision, you need vitamin A in good amount. Apart from the eyes, they are also required for the healthy skin. Why? Because skin glands require vitamin A for their cell to grow normally. If the vitamin A is not there, your skin will be peely, it will become dry, it will become dull. So for lustrous skin and for healthy skin, you need proper amount of vitamin A in your diet. Then it is also required for the normal growth and development. As I told you, kids which are at the growing stage, they require all the nutrients in a higher amount as they are required by an adult because their cells are growing, their tissues are growing at a higher speed. So they require vitamin A in large amount for their proper growth and development. As you can see in the picture also, they are required at each and every stage, like for a child also, for a adolescent girl also, and for a mother also. The vitamin A is very important, and not only for the eyes but also for the skin and the proper development of the cells and tissues. What happen if you are not taking vitamin A in appropriate amount? First, you will not be able to see because your eyesight will be compromised. When you are unable to see in the dim light, that condition is known as a night blindness because when as the night is coming, you won't be able to see in dark. So you require sunlight or either a light to see properly. So inability to see in dark or inability to see in dim light is called as night blindness. This is the first stage of vitamin A deficiency. If you are not taking vitamin A uh, properly, then first of all your eyes will stop seeing in dark, and that condition is known as night blindness. As the name suggests, you are blind in night. If this is not treated, then the condition becomes severe, and the second stage that comes is the drying of eyelids. Eyelids, anyone is uh, asking any question? I heard something, I guess. If not, then I will be continuing.
No, madam, you can continue, please.
Yeah. So if the night blindness stage is not being treated properly, your eyelids will be dry and your eyes will become dull and you won't be able to see even in the light, and even in the daytime you will be not able to see properly. Your eyes will become dull and your vision will be compromised. Further, if that condition is also not treated, if you're not treating that, if you're not having vitamin A in proper amount, and if you're not taking any medications, you're not taking supplementation of vitamin A, then your eyes will become soft and get infected. There will be infection inside your eyes, and this will lead to the permanent blindness. And this is how a person become blind, a child become blind if the conditions are not being treated. And that is why the government has started the various programs, and there is a blindness program in our country. In India we have a vitamin A, there is a program in which we provide supplementation of vitamin A to the child, to the uh, adults also. So it is very important to take vitamin A in appropriate amount. Now we are starting with the another vitamin, which is vitamin D. Vitamin D, from where we get vitamin D? Anyone can tell me from where we get vitamin D? Is there anyone who can tell me apart from the food sources? No one? Come on, just just let's start an interactive section. If you know that which food groups contain vitamin D, just tell me. No one?
Okay,
What?
vegetable, vegetable.
No. Anyone other?
Okay,
Protein.
Not protein. You cannot get vitamin D from protein.
Okay.
Yes. Anyone? Anyone else? Okay. I will tell you.
what if I say fatty food?
Which food?
Carbohydrate, carbohydrate.
No, 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 not carbohydrate. I'm asking you the specific food source. You cannot take it from carbohydrates, proteins. They are the food groups. They are nutrients. So, okay, let me clear out and let me tell you. First of all, the maximum amount of vitamin D you get from sunlight. You can see in the slide also, it is given in the picture that a man is standing, and from where he is taking the vitamin D, it's from the sun, because sun rays contains UV light, and when on our skin the UV light is falling, it will start, our skin will start synthesizing the vitamin D in our body. So apart from the food sources, you can get the vitamin D from the sun rays, and that is why the deficiency of vitamin D is increasing now in day to day life in all the countries. The people are deficient in vitamin D. Why? Because they are applying the sunscreen lotions on their skin when they are going outside. And what happened when you apply sunscreen on your skin? It will stop of it will stop UV rays, and it will protect your skin from the UV rays, and that your skin won't be able to synthesize sufficient amount of vitamin D. Hence, it is always always advisable. It is always suggested that please stand under the sunlight at least for 30 minutes so that your skin can synthesize vitamin D, because sunlight is very important for your body. If you want vitamin D, if you want your bones to be strong, you need sufficient amount of sun rays. So from where we are getting vitamin D? From sun. Then not only sun provide us vitamin D, there are food sources also that can give you vitamin D. So here is a slide which is showing you that apart from sunlight, you can get it from fish. Fish contains vitamin D, and I have not given it here. Mushrooms are very important, is a very important source of vitamin D. It also contains the vitamin D precursor. But cereals are very limit. They contain very limited source of vitamin D. Only sunlight can provide you maximum amount of vitamin D, or fish can provide you, or mushrooms. Apart from that, no, nothing, no source contains vitamin D. So you can list down, I guess I'm clear now that in which food sources you can found vitamin D. So what is the function of vitamin D? Why we are saying that we have to stand outside the sun rays? Why? Because it helps in proper absorption of calcium in our body. And calcium, as I told you yesterday in my lecture, calcium is important for bones and teeth. So your bones become healthy when you have a sufficient amount of vitamin D, because it will help calcium to be absorbed in good amount. So vitamin D is required for your bones, and you can write in your exams also that it is important for the proper absorption of calcium. This is the important function, and this is the only function vitamin D provides us. Now what happened to vitamin D in the body? How it is being absorbed? We discussed in yesterday lectures how carbohydrate is being absorbed, how
Ma'am, can I
protein.
ask a question?
Yes,
Uh, Yesterday you told me that excess vitamin D will lead to stones.
yes.
That is okay, but how nowadays the tablets are coming calcium plus vitamin D. Persons like me, aged
Why?
persons.
Because calcium is not being absorbed if there is no vitamin D. This is why, and we are, today's life, we are sitting inside the room only. Nobody is, exposed to sunlight. So there are tablets available in the market that provides you vitamin D along with the calcium. Because if the vitamin D is not there, calcium will not be absorbed properly, and they will develop, the body will start developing the stones out of calcium. So for proper absorption of calcium, you need vitamin D, and this is the reason now supplementations are there, in which both the vitamin D and calcium is present. Is it clear?
Okay, madam. Thank you. Thank you.
So what happens to vitamin D in the body? It is absorbed along with the fat from the small intestine. So not in the stomach, not in the mouth. Its absorption, its digestion starts inside the small intestine, because it is a fat soluble vitamin. So it needs a fat, and as we discussed in yesterday's lecture, fat is being absorbed and digested in small intestine only. So like that, vitamin D also gets absorbed along with the fat in the small intestine. You can connect it with the yesterday's lecture, because everything is connected with each nutrient. So here, because vitamin D is fat soluble, so like fat, they are also being absorbed in the small intestine. Now, bile is essential for effective absorption of fat, because bile is present in the small intestine, and bile is being produced by a pancreas. So, therefore, bile is also necessary for vitamin D. So, they are similar. Fat digestion and vitamin D digestion is almost similar. Once absorption is completed, vitamin D enters the bloodstream as a part of chylomicrons. Chylomicrons are nothing but the droplets of fat. Vitamin D formed in the skin on exposure of sunlight also enters the bloodstream. As I told you, when you stand outside uh, under the sun, your skin starts synthesizing the vitamin D. So that vitamin D also goes into the bloodstream, and with the help of fat droplets, which are known as the chylomicrons, they are being absorbed into the small intestine. Clear? Some of it is being stored in liver, and thus remaining is distributed by the blood to the various body tissues, because vitamin D is required by the every cell and every tissue. They are required in bones, they are required in teeth, they are required in cell structure also. So via blood they are being transported to the each and every part of the body. So this is about the absorption of vitamin D. Now we are moving forward with the deficiency of vitamin D. What happens if you are not taking right amount of vitamin D? Again, bones will become weaker and soft. A child will find difficult to bear his weight, his or her weight. He won't be able to stand properly because the bones will be weak, and weight, your body will not be, you know, able to take that weight, and you will be bored. You will be at the stage when you will be crawling. You won't be able to walk, you won't be able to stand. In later ages, bones of pelvis in women become weak. Nowadays, vitamin D deficiency is present in, I guess, 80% of women are suffering from osteomalacia, which is a condition where they find difficulty in walking. Their knees are in pain, their legs are in pain. Why? Because they are not taking vitamin D in sufficient amount. At the older age, the body, doesn't absorb calcium in much amount, because in younger stage your cells are new, your tissues are new, they synthesize vitamin D in proper amount, and with the help of vitamin D the calcium is being absorbed in right amount. But as you get old, your cells and tissues are not able to absorb calcium in right amount, and if you're not taking it from the sunlight, if you're not taking it in your diet, the condition will become severe, and your bones will start, you know becoming weak day by day, and they will uh, finally a stage will come where they break easily, and fractures, and they are become very common at that stage. So this is all about the deficiency of vitamin D, and it is very important vitamin. Nowadays, it is very important vitamin. So it is always advisable to take right amount of vitamin D from the food sources and from the sun also. Now moving forward to the another vitamin, which is vitamin E. They all are fat soluble vitamin, remember. Now, vitamin E is also important for the healthy functioning of reproductive system, but its deficiency is rare because vitamin E is found in oils and fats and oil. The main sources fats and oil, which we eat in appropriate amount, and its deficiency is seen very rare because it is present in many food, or as I told you, uh, seeds, nuts, they all contains oil. Invisible fats are present in them, and they, if the invisible fat is present, vitamin E is there. Like in whole grains, vitamin E is there. In nuts, peanuts, almonds, they all contain vitamins E. And coconut is a good source of vitamin E because coconut has lot of oil in that. Coconut oil is present in that. So they all have a enough amount of vitamin E, and vitamin E is absorbed easily in our body, and that is why its deficiency is not seen commonly. So vitamin E is not that important for our body. Of course, vitamin is important, vitamin E is important for reproductive system, but like other vitamins, its deficiency is not common because it is present in almost all food groups. So this is about the vitamin E and how vitamin E is being absorbed in storage as like vitamin D, like vitamin A, because this vitamin is also from the category of fat soluble. They also require fat and bile because bile is required for fat absorption. So indirectly, vitamin E also require fat and bile. So you can easily write in your exams because the absorption and storage is similar for all the fat soluble vitamins, and they are being absorbed in small intestine only as a part of chylomicron, and as I told you in the case of vitamin D also. Then almost all the body tissues have small amount of vitamin, but it is mainly stored in muscles and adipose tissue. So storage is little bit different, as vitamin D is being stored in liver and then it is being transported to all the body parts and organs. But here in case of vitamin E, it is stored in muscles and adipose tissue. So you just have to look for the storage part. Otherwise, for absorption part, it is same for all the fat soluble vitamins. I guess this is clear, and you can read also in this slide that absorption is same as it was for the fat, and then you can write down where it is being stored. It is being stored in muscles and adipose tissue. Now we are finally coming to the last vitamin from the category of fat soluble vitamin. And now vitamin K, why it is important? Because it helps you to bring out the clotting of blood. You all must have seen when you are injured, the blood is coming out of your body. After some time, the fibers of maroon color will start connecting, and they will form a clot. um after a few minutes, it will start forming a clot on the wound. So how it has happened? This happens because of the presence of vitamin K in your body. If vitamin K is not there, the clotting will be delayed and the loss of blood from your body will be uh, at a high percentage. So vitamin K is very important. And in which food sources vitamin K is present? Vitamin K is present in green leafy vegetables like spinach, radish leaves, methi leaves. So they all are vitamin K rich food. All green leafy vegetables, because they contain carotenoid, which is the coloring agent, but they also have a high amount of vitamin K in them. And you just need to know a little about the vitamin K. So I have prepared in this slide only that its deficiency leads to loss of blood due to a cut or injury, as I discussed with you, because it helps in clotting of blood. If vitamin K is not there, your loss during the injury will be at a high percentage, and uh, that will lead to the anemia. Because what is anemia? When you are lack of hemoglobin, when you have a lot of blood losses from your body, and uh, blood cells are not in the right amount, then it will lead to a condition known as anemia. So vitamin K is important because it helps in bringing out the clotting of the blood when you are being injured. Now, pregnant women and infants are often given doses of vitamin K to check bleeding during childbirth and brain hemorrhage, respectively. Because when a pregnant woman is giving birth to a child, there are blood losses. And if the pregnant lady is deficient in vitamin K, then the losses will be high, which which are risky for a lady. She might die because the bleeding is at a mm, bleeding is increasing, and during childbirth maybe there will be a brain hemorrhage because of loss of blood. So it is very important, and doses are given, the supplements are given for vitamin K, so that sufficient level of vitamin K can be maintained during that stage. So vitamin K is very important for pregnant women and for infants, and that is why the government have started this scheme that vitamin K has to be given during that particular stage. So I guess it is clear for you all that vitamin K is important, and especially during the pregnancy, vitamin K is important. Now, how vitamin K is being absorbed and stored in our body? The absorption of vitamin K require bile since vitamin K is fat soluble. As I told you, it is similar for all the fat soluble vitamins. Then, after absorption from the upper part of the small intestine, the vitamin is distributed to various body tissue. Like other vitamins, this is also similar. Vitamin K is stored in very small amount in the body and its concentration is not high in any particular tissue. And I discussed with you yesterday also that we have a macronutrient and micronutrient. So this is micronutrient because we need it in micrograms. It is not a vitamin which is required in high percentage like vitamin A, vitamin D. It is required in very less concentration. So it is being stored in very small amount in our body. But it is important. Now we are moving to the water soluble vitamins. So water soluble vitamins are two vitamins, vitamin B and vitamin C. Under the vitamin B group, there are five vitamins: vitamin B1, vitamin B2, vitamin B3, vitamin B12, and folic acid. They all are vitamin B. And apart from their name as a vitamin B1, B2, they have another names also, like B1 is called as a thiamine, B2 is called as riboflavin, B3 is called as niacin, and vitamin B12 is there, and folic acid doesn't have a B1, B2 numbering, but it is a separate vitamin, but comes under the vitamin B group only. They all five are water soluble in nature because they are water soluble vitamins, and loss of throwing water in which food has been soaked or cooked. There is a problem with this category. When you cook foods rich in vitamin B, when you cook them, when you soak them, what happens? Your vitamins leaches out into the water, and that is why their absorption in the body is, you know, is of very much importance. So right, appropriate cooking technique is very important in case of water soluble vitamins. Otherwise, they, if you soak them for much higher time and if you cook them, with a method of boiling or steaming, then boiling and frying, then not steaming, sorry, boiling and frying, then most of the vitamin B leaches out into the water or it evaporates in the water droplets, in the form of water droplets. So nothing is being, you know, available to uh, our body when we eat such food. So it is very important to use the right technique of cooking when you are cooking the vitamin B group rich food. Then here is a slide which is showing you the food sources of different vitamin. You can see vitamin B1, that is thiamine, and vitamin B3, that is niacin, are present in cereal and cereal products like whole grain bread, wheat, other cereals, rice, beans, peanuts. They all are rich sources of vitamin B. Especially rice contain good amount of vitamin B1. Then vitamin B2 rich foods are carrots, beans, eggs, liver and cheese. So some of the vegetables, some of the fruits and not grains. B1 and B3 present in grains, B2 present in vegetables and fruits and meat source is liver, and vitamin B12 is only present in the non-vegetarian sources. It is not available in the plant sources, and hence this is the reason all the vegetarians, mostly 90% of the vegetarians, are deficient in vitamin B12 because if they are not having meat, they are not taking non-vegetarian sources, they doesn't get vitamin B12 because it cannot be synthesized in our body. They have to be taken from the food sources only, and if vitamin B12 is not present in plant source, then from where the vegetarians can get this vitamin? So it is always advisable, it is always suggested for the vegetarians to take vitamin B12 supplements. Otherwise, they all are deficient in B12. Only supplements can provide them vitamin B12. So here you can see the slide is giving you the different food sources of different vitamin B. Now, what are the functions of vitamin B? Simple: for normal growth and development, for healthy functioning of vital organs like heart, nerves, brain, skin, eyes. For all organs, vitamin B are required, and vitamin B12 and folic acid is important for normal functioning of red blood cell, which is a hemoglobin. So, when you are deficient in folic acid, B12, your hemoglobin won't be synthesizing and you will be deficient with the red blood cells. And what happen when you are not having appropriate amount of red blood cells in your body? You will lead to develop anemia. As I discussed with you today also, anemia is a condition where you have a low levels of hemoglobin in your body, and when you have a low level of hemoglobin in your body, you feel tired, you are not able to work efficiently, your work ability gets decreases, you get tired very easily, and your skin become pale because you are deficient in red blood cells. So you start developing jaundice, which is a condition of becoming your eyelids, your skin become yellow because you are deficient in red blood cells. So this is why vitamin B12 and folic acid supplementations are given during pregnancy, when a lady is pregnant, because they need high amount of folic acid so that red blood cells can be synthesized properly. If they are deficient in hemoglobin, there will be difficulty in delivery. When they are delivering a child, when they are giving birth to a child, there will be a very difficulty and there will be chances of miscarriage. So, folic acid supplementations are given to the pregnant women uh, during all the trimesters in trimester 1, 2, 3. During all the three trimesters, the supplementations are given by the government schemes. There are Anganwadis, there are self-help groups in which these supplementations are being distributed by the medical staff. So it is very important for our body. Then we have listed the deficiency of these vitamins here in this slide. Vitamin B1, which is a thiamine, leads to a condition known as a beriberi. In this, you lead to loss of appetite, there is a weakness, there is a poor movement of the muscles. So if you are deficient in vitamin B1, you are not taking cereals, that is wheat and rice, in appropriate amount, your body will become weak and your muscles will become tight. Your fingers won't be able to move properly. You will have a pain in joints, and there is a poor movement wherever the muscles are required, like in joints, like knee joints, your finger joints, your elbow joints. They will start, you know, having a pain and you won't be able to move them properly. Then there is a second vitamin which is known as a vitamin B2. If you are not having this vitamin, then it will lead to angular stomatitis. This is nothing but the inflammation of the tongue, and you must have noticed in your daily life also that you sometimes you develop ulcers inside the mouth. This is because of the deficiency of vitamin B2. And when you develop ulcers in the mouth, the doctor, what doctor advise? Doctor always give you vitamin B capsules because ulcers uh, develop in the mouth when you are deficient in vitamin B2. Clear? I guess now you can write in exams also, as I'm giving you the day-to-day life examples also. So it must be clear to all of you that what vitamin B1 deficiency is, what vitamin B2 deficiency is. Now we are moving forward to vitamin B3, which is called as niacin. And when you are not taking niacin in a right amount, it will lead to pellagra. This is a disease where you have itching and burning in your skin. This vitamin is related to the skin. If you doesn't have a right amount of vitamin B3 in your diet, you are not taking fruits and vegetables in appropriate amount, your skin will start have a burning sensation and itchy skin will be in there will be a result of itchy skin, and sometimes you may develop the diarrhea also. Mental depression, confusion, and poor memory, they are also associated with this vitamin. And if you're not taking this vitamin B3, then your brain will be affected and the brain function will be hampered, like you will be mentally depressed, there will be confusion, you won't be able to judge things properly in a proper manner, and you may lose your memory. So this is a very important vitamin, and these are the symptoms of pellagra. So you can write down and you can make points in your notebook, that what happened if you develop pellagra in the body, what happened when you develop beriberi in the body, and what happen when you have a angular stomatitis. You have to note down the two, three points of these each deficiencies. Then, as I discussed with you, vitamin B12 and folic acid are required for the formation of red blood cell. So, if the red blood cells are not formed in adequate amount, then they will lead to a condition known as anemia, which is a dangerous disease and which is very common in ladies especially. So these are the deficiencies of vitamin B and its group. Now coming to the another vitamin which is from the water soluble category. This is known as a vitamin C, and the another name of vitamin C is ascorbic acid. You can see in the slide there are lot of fruits and vegetables that contains vitamin C. For your easy memory, I must tell you that fruits and vegetables which are sour in taste, which are bitter in taste, they are good sources of vitamin C. For example, lemon, which is sour in taste, orange, then amla, grapes, tomatoes, because they have sourness in their taste, pepper, kiwi, they all are good sources of vitamin C. Even broccoli contains good amount of vitamin C. So here is a picture which is showing you the food sources which are rich in vitamin C, and they are mainly found in fruits and vegetables, cereals, millets, milk products. They all are bad sources, or you can say the poor sources of vitamin C. You cannot get vitamin C from the carbs, from the proteins, from the fats, but vitamin C can only be taken from the food group of vegetables and fruits. So it is very important. All the vitamins are present in fruits and vegetables only. Especially vitamin C is important, and they are found in only fruits and vegetables. Coming forward to the functions of vitamin C. Vitamin C is important for your teeth, gums, and skin. Teeth are important because teeth are required for chewing the food. So it is the first stage where the digestion starts. So if your teeth are not healthy, you won't be able to chew your food properly, and you won't be able to, taste your food properly. So it is important for our teeth. There is a deficiency called as a scurvy. We will be discussing it in next slide. That happens when the vitamin C deficient your body becomes. Then for wound healing, as uh, along with the vitamin K, if you remember, vitamin K is required for the mm, for it is important for the wound healing because it forms the clot when you get a wound. Along with that, vitamin C is also important. Why? Because there is a special protein called as a collagen is found, and this protein is found in the connective tissues, which hold together the different tissue and form a cement hold brick together, which is called as a clot. So here is a description of what is clot basically. You need not to remember this. You just have to keep remember that vitamin K is important for blood clotting, and along with vitamin K, you need vitamin C for blood clotting. That's it. Then dealing with stress. It is very important. Ascorbic acid play an important role in releasing two hormones, which is epinephrine and norepinephrine. These are the two hormones which are being released when you consume vitamin C rich fruits or vegetables. They help in dealing with the stress because they are happy hormones. So when you are in stress, you are always advisable to take vitamin C rich fruits because they releases the two hormones. The names are given in the slide, and when these two hormones are being released by the body, you feel relaxed. The another function of vitamin C is absorption of iron. I taught you about the interrelation of the nutrients yesterday in my presentation, that all the nutrients are interconnected with each other, and one nutrient may require the help of another nutrient for the absorption. So vitamin C is improve the absorption of iron. So it is always advisable to have iron rich food with the vitamin C rich fruit so that iron can be absorbed better in your body. So it helps in absorption of iron, which is an important function, and you must remember this function. Vitamin C is required for the absorption of iron. Also, it has an ability to protect you from infection. When there are infection, like I'm giving you an example of a recent disease which was known as a corona, and in corona you all must be aware that doctors were prescribing vitamin C tablets. They were giving vitamin C supplementations to all the patients. Why? Because vitamin C keeps us away from the infection. The body has a protective mechanism that you know uh, enhances when you take vitamin C rich foods or vitamin C rich fruits, vitamin rich C supplementation. So you can write that example in your exams also, that vitamin C protect us from the infection. And recent example you can quote, which is of corona, that during corona doctors were advising and suggesting vitamin C supplementation because vitamin C helps to protect our body. It helps to protect us from the infection. And what happen when if you are not having right amount of vitamin C in your body, you will lead to a condition known as scurvy. Scurvy is nothing but the condition where your teeth will be loose, they may fall off, and there will be bleeding inside your gums. And there is a pain, you are not able to chew your food, you're not able to have any kind of food. Why? Because the vitamin C is not there in your body in right amount, and you have developed scurvy, which is a painful condition where your teeth fall and your gums start bleeding, and you have a swelling. Just, just wait a second. I'm really just wait a second.
Yes, students, please wait for a while. She will come back. It seems there is a technical disturbance. with her laptop. Please wait. Meanwhile, you think your questions what to be asked. Session should be
Yeah, I'm here. I'm here. You guys can ask any questions if you have any questions. I'm really sorry for the
no problem,
inconvenience
madam. Please
for
continue.
a few seconds. Hmm. Is there any question till now? If you have any questions related to fat soluble vitamins or water soluble vitamins, and if anybody have any confusion or have any questions, they can ask me. Yeah, Thomas, you can ask your question.
Yes. Yeah. Okay. Okay. I think when you're talking about the vitamin B, where you have a folic acid, okay, then my question goes like this: why do we give folic acid to pregnant women?
Because uh, folic acid is important to pregnant
Can you
women.
hear me,
Yeah, we give supplementation of folic acid to the pregnant women because
madam?
it helps in synthesizing of red blood cells. If the folic acid deficiency is there, there will be deficiency of red blood cell, which leads to a condition known as a anemia. In during anemia, the pregnant ladies cannot deliver, their babies normally if the red blood cells are not there, because uh, at a child at a stage when the lady is giving a birth to a child, there may be chances of bleeding, and if a bleeding is there, there will be loss of blood from her body, and if the right amount of red blood cells are not there, if there is a deficiency of red blood
Okay.
cell, then the lady can die. So it is important to have folic acid in their body so that they can synthesize red blood cells in good amount. This is the reason why folic acid supplementation is given, and they start from the first trimester only. Folic acid supplementations are given to the pregnant lady so that the red blood cell amount can be synthesized in good amount. Okay. You understood my answer? Shall I continue with my presentation?
Yes, madam.
Okay.
Okay. Thank you. It is now clear.
Yeah.
Thomas, please ask.
What is the meaning of deficiency? I'm not understanding. So,
No.
Hello, Thomas. Okay, your voice is not clear. Kindly type your question in the chat box so that
Yeah.
madam will see and answer your question. Please.
Yes, your voice is not audible properly. You can write your question in the chat box.
Okay, madam. Now you can continue.
Okay, now I am continuing with my slides. So, as I discussed, the vitamin C deficiency leads to a condition which is known as a scurvy, and there is a pain in your teeth, there is a bleeding in your gums, and your teeth may fall at a severe condition. Along with the teeth, there will be a pain in the joints, like knee joints and elbow joints and your finger joints. So vitamin C is very important for your teeth also, for your bones also, and for your skin also. Now we are here to talk about the absorption of vitamin C. Ascorbic acid is readily absorbed from the digestive tract. Because it is not a fat soluble vitamin, its absorption starts in the stomach only, where it is being broken down and being absorbed by the body tissue. Organs and glands like spleen, bone marrow, liver, pancreas, kidney, and the retina of the eye, they have a high concentration of ascorbic acid. So these are the organs where the vitamin C is being stored, and they are being stored in the higher amount as in comparison to the other organs. So you can write down it that in bone marrow, in liver, in kidney, and in the eyes, the ascorbic acid is being absorbed in high amount. Now, I guess till here it is clear to everyone. Because I am moving to the another unit where we will be discussing about the minerals. So, if anybody is having any doubts in the vitamin, they can ask. Otherwise, I'll move forward to the minerals. I guess everyone is clear about vitamins. They can read. They can read it in the uh, material also which is provided to you, study material. If you have any doubts, you can write in the chat box. Now I am continuing with the another unit that deals with the minerals. So apart from the nutrients, they also contains minerals. Food which we are eating, as I told you yesterday, food have a certain nutrients. And nutrient, what are nutrients? They are carbohydrate, proteins, fats, vitamins, and minerals. So we talked about carbohydrate, fat, proteins, vitamins also today we covered. Now we are moving forward with the minerals. Why minerals are important? Minerals, every nutrients, first of all, they are required for growth and development. So this point is common to all the nutrients that they are required for the proper growth and development of the body. Then specific function. The common function is they are required for the growth and development, and then you can write down the specific functions as discussed with you. Now minerals are required in small amount, and that is why they are micronutrients. But there are macronutrient minerals also. I will be telling you in the next slide. And main minerals which are required for our body are calcium, iron, and iodine. These three are important because their deficiency is prevalent in the population, and other nutrients, other minerals are required in very small amount, and their deficiencies are not that important. So we will be discussing all the minerals along with the calcium, iron, and iodine. This is a slide where I have shown that which minerals are required in large amount, and they are coming under the macronutrients, which are required in smaller amount, and they are called as a micronutrients. So large amount minerals are calcium, phosphorus, sodium, potassium, chloride, magnesium. These are the minerals which are required in a large amount. They are required in milligrams, grams, and milligrams. And in the right side, there are minerals that are required in micrograms, milligrams. They are iron, iodine, zinc, and copper. So these four are required in very small amount, nanograms or micrograms. You can note down it, and this is given in your study material also. You can read what macronutrients and micronutrients are. I guess I have also cleared this thing. Now coming to the first mineral, this is calcium. Okay, this is present largely in our body. In every cell, every tissue, every organ, they need calcium for its proper growth and development because calcium is required for the structure development. If a cell is prepared, if a cell is developing inside the body, for its outer layer, it will require calcium. So maximum amount is in bones and teeth along with the mineral phosphorus, but every cell and every tissue and every organ require calcium for their proper development. Here are I have quoted some food sources which are rich in calcium. First of all, milk and milk products. They gives you maximum amount of calcium. Yogurt, curd, cheese, they are also they also contains good amount of calcium. Then soya bean, oranges, almonds, sesame seeds, they all have good amount of calcium which is readily available to the body. So these are the food sources uh, that provides you enough amount of calcium required in a day. If you are adding these food groups, food sources in your daily diet, you are having sufficient amount of calcium. Now, it is clear to all that calcium is required for the healthy bones and healthy teeth. So, it is a very common function that calcium plays, and everybody should be aware of this, that calcium is required for bones and teeth. Also, as we discussed, that calcium is required in combination with phosphorus and vitamin D. It is available for the body. So, if you are having calcium along with the vitamin D, along with the phosphorus, your body will start absorbing it at a higher speed and it will be easily available to the body. Then, apart from maintaining the healthy bones and healthy teeth, it also regulated the other mechanisms like clotting of blood. So it's not only vitamin K, not only vitamin C, but we need calcium also, which helps in the wound healing. So these are the three nutrients. Later on, you will be knowing about the other minerals also. Till now, you just recall that vitamin K, vitamin C, and calcium is required for the clotting of blood. And if calcium is required for healthy bones, definitely its deficiency will lead to the weaker bones, which is common for vitamin D also. So if you are deficient in calcium, if your body is deficient in calcium, if not taking calcium in a right amount, then there will be a condition develop in a child which is called as a rickets, where the child cannot stand properly. His or her bones will be weak, they will break easily, they won't be able to bend properly, and they may need sticks to walk, because they can't stand properly on their feet, they can't take their weight uh, at all. So this condition is known as rickets. Then there is a second condition which we discussed in the case of vitamin D deficiency also. There is a disease called as a osteomalacia in women. In this condition, bones becomes weak and they crack easily. There is a high knee joint pain, and women have a difficulty in walking, and they are unable to hold their body weight for longer time. They can't walk properly, they can't walk longer, and they need help to stand. They can't, uh, stand up immediately. They need help, so they need someone help to stand. So these all condition happen when your body doesn't have enough calcium in through your diet. So ultimately, everything is interconnected with the weak bones. So these two deficiency you can write down. In children, there is a ricket, and in women, there is a osteomalacia, and another condition is known as a osteoporosis, which is the other severe deficiency of calcium, and which is a condition where again your bones stop supporting your body weight and you have a difficulty in walking. So they all are interconnected with the weak bones. Now we are coming to the absorption and storage, and unlike fat soluble vitamin, they are absorbed chiefly in the intestine. They doesn't require fat for their absorption, they doesn't require bile for their absorption. Normally, it is seen that from an average Indian diet, only 20 to 30% of calciums get absorbed because they have less intake of vitamin D, and vitamin D is required for the proper 100% absorption of calcium. But because the bioavailability of calcium is very low in the Indian diet, so only 20 to 30% of the food, whatever they are consuming, only 20 to 30% of the calcium is available for the body. The rest is excreted in the feces. So we can we can say that calcium bioavailability is very poor. The absorbed calcium is then used to perform the functions as discussed earlier, like for the bones and for the teeth, they are absorbed there to perform those functions. The rest of the calcium is excreted in the excreted outside the body in the form of feces. Otherwise, it is excreted in the urine and feces, but the amount is very small because the bioavailability is very less. So absorption of the calcium is very low, which is only 20 to 30% from the diet. Next is sodium. Uh, Sodium is, can you tell me in which food sodium is present? Anyone? Please unmute your mic and tell me in which food sodium is present. Anyone can tell me the food sources of sodium? No, no one knows about it?
Let me just say milk.
No, milk doesn't have sodium. Wrong answer. Anybody else? Okay. Sodium is nothing, but it is present in our common salt which we are using. Sodium is not present in any fruits and vegetable, any food material, but it is present in common table salt. Why? Because salt which we are eating is nothing but it is sodium chloride. The scientific name is sodium chloride. Salt is made up of sodium chloride, and from there only we are getting this sodium. Okay. So now I guess everyone can remember this. And 1 teaspoon of salt which you are having will provide you almost 2000 milligram of sodium, which is enough for a day. So it is always advisable to have less salt in your diet, otherwise you will develop a state which is known as a hypertension, where your blood pressure rises. So your salt intake should be less, and only 1 teaspoon of salt is enough for your day to have to meet the recommended dietary allowances for sodium. Then other rich sources of sodium include milk, but milk doesn't have a sodium in a bioavailable form. I'm giving you because you have to write in exams also. Common table salt is the only example of having a sodium in your diet. Milk contains very sparingly amount of sodium. Egg white, meat, poultry, fish. Why fishes? Because they are present in oceans and they have a certain amount of salt in them. So that is why fish is a rich source. You can say fish are the rich source of sodium. But apart from that, none of the food can provide you enough amount of sodium apart from the table salt. So coming back to the slide, where sodium is present. Sodium is present in the extracellular fluid. Here is a slide which is presented to you with a diagram. You can see there are two cells present, and outside the cell there is a fluid which is called as a interstitial fluid, also known as a fluid with intracellular fluid, which is present inside the cell. And then outside the cell, I have shown that there is an extracellular fluid because it is present outside the cell. As the name suggests, it is an extracellular fluid, and sodium is present in the extracellular fluid. So, extracellular fluid, what is extracellular fluid? It is the fluid which is present outside the cell, as the name suggests, and intracellular fluid is which is present inside the cell. Potassium is the mineral which is present inside the cell, and sodium and chloride are the two minerals which are presented in the extracellular fluid. So, sodium is presented in the extracellular fluid. You can see in the diagram also, it is clear what is intracellular fluid, what is extracellular fluid, and which mineral is made up of intracellular fluid and which are made up of extracellular fluid. So sodium is required to maintain the extracellular fluid in the body. Now, what is the function of sodium? Why we are taking sodium? Because as the name suggests, regulating the balance of extracellular and intracellular fluid. If sodium is not there, then extracellular fluid concentration will be imbalanced, will become imbalanced. If sodium will not be in the right amount, there will be imbalance in the fluid content and the cell will not perform their function properly. Then second function is regulating the alkalinity and acidity of the body fluid. Sodium tends to make the body fluid alkaline in nature. There you all must be aware about the pH values. There are foods that are acidic in nature and there are foods which are alkaline in nature. So your body fluid has to be alkaline in nature. Their pH has to be around the 7. So to maintain that pH of the body fluid, sodium is required. Then another mineral which is required to maintain this acidity is chloride. So sodium combined with the chloride in the fluid and together they help to maintain the balance between the alkalinity and acidity of the body fluid. So sodium, the main function of the sodium, the important and only function you can say of the sodium is to maintain the alkalinity of the extracellular fluid. Clear? Then aiding in the passage of messages from one cell to another cell. There are signals that our brain send to perform the actions and reactions. So sodium also help in that function also. Sodium uh, helps in transferring the messages from one nerve to another nerve. Like if I have to pick a water bottle, then my brain will send a signal to my uh, hand that okay, you have to pick that water bottle. So that message is, that function is performed by the brain nerve, and sodium help in transferring that messages from one organ to another organ. So this is another function of the sodium. This I have showed you that common table salt is nothing but it is a pure sodium chloride. So maximum amount of sodium we get is from the salt only, and 1 teaspoon of salt provide you 2000 milligram of sodium, which is enough for enough to meet your recommended dietary allowances of the sodium. And other resources are also available. In that you can write first of all fish, because they are present in ocean. They are their origin is from oceans and oceans are salted in nature. So that's why fish, meat, poultry, they have good amount of sodium. Then how they are absorbed and excreted in the body? They are absorbed by the digestive tract only, and they are used for various body functions like for maintaining the extracellular fluid and for transferring the messages from one nerve to the another nerve. The excess amount of sodium, what happened to that? That body, if once the sodium is absorbed for the functions which they perform, the other is excreted by the urine, sweat and feces. These three are the waste products from the body. So rest of the sodium is being thrown out of the body via urine, sweat and feces. So this is clear to everyone about calcium and sodium. Now we are moving forward to the another important mineral, which is potassium. Potassium provides Potassium is present in twice as much as amount of sodium, and that is why when I started the slides for the minerals, I categorized potassium under the macronutrient because it is required in large amount. It is required in grams. not in micrograms like zinc, selenium, copper. They are required in micrograms only, nanograms only. But calcium and potassium and sodium, they are required in grams. So potassium is present as much as amount as sodium in the body. And while discussing about the structure of cell, I told you that potassium is present in the intracellular fluid. Hence, the function for the potassium is similar to that of the sodium, that it also helps to maintain the balance of the fluid of cell, which is intracellular and extracellular. So they are interconnected. Potassium, chloride and sodium, they three of these minerals perform similar function because they are present in the cell fluid. The another important function that potassium plays is they have a role in the activity of skeleton and heart muscles. So maintaining the balance of the fluid is a common function that these three minerals perform: sodium, chloride and potassium. And the specific function, like sodium and chloride, they also perform the other functions also apart from balancing the fluid, from balancing the body temperature. The potassium play important role in muscle activity. Again, like sodium, it also helps in transmission of messages because they are present in fluid, and fluid are present in all over in our body. So they also helps in signaling the message from one tissue to another tissue. And what are the food sources from we get potassium? Potassium is widely distributed in foods like meat, poultry, and fish. These are the richest source from where you can get the potassium. In vegetarian sources, you can write down in your notebook, banana contains high amount of potassium. Banana is the richest source for vegetarians to get the potassium, to grab the potassium from the daily diet. Otherwise, for non-vegetarians, meat, poultry and fishes, they contains good amount of potassium. Now, like other minerals, we discussed about the absorption and storage. Potassium is also absorbed in the intestine. They are basically stored and being absorbed to perform the body functions which we discussed, like maintaining the fluids in the body and to deliver the messages from one tissue to other tissue, and they have a from one cell to another cell, and they have a special function in maintaining the muscle activity. So these are the three important functions that potassium perform. And what happened to the excess of potassium? Once it is being utilized in the intestine, the extra potassium is thrown out of the body in the form of urine and feces. So this is common to all, that whatever whatever amount is required for the body, the intestine will absorb that to perform their functions. Rest of the potassium or rest of the minerals like sodium, chloride, calcium, they all are thrown out through the in the form of urine and feces. Moving forward, there is a third mineral which is called as a chloride. So, as I discussed with you, chloride is present inside the cellular fluid. So, chloride is present in the extracellular fluid, and sodium chloride, and like sodium, they are also present in salt only, because salt is made up of sodium chloride, and hence the chloride content is taken by the body from the common salt which we eat. So, which food group provide you chloride? It's not, it's only the common salt as in case of the sodium. Now, what functions chloride perform? The function of sodium, potassium and chloride are closely interlinked, as I told you, and it is similar to that of the sodium and potassium, that it also helps in maintaining the balance between the intracellular fluid and extracellular fluid. So it is similar to all these three minerals. And now if a question comes that how you're gonna right about the absorption and excretion. So chloride is also absorbed in the upper part of the intestine, and the excess of the chloride is being thrown out of the body in the form of urine and sweat. So which is similar with that of the potassium and sodium. So these three minerals are interconnected, interrelated to each other because they are present in the fluids of the body. Correct? I guess here we are ending with the unit 5. Now we will be moving forward to the sorry, there is one another mineral, that is magnesium. The adult human body contain approximately 20 to 25 grams of magnesium. Again, it is the percentage is given in grams, hence it is a macronutrient, not a micronutrient. And about 60 to 70% of the magnesium is present in the bones. So, calcium and magnesium and phosphorus, they three are interlinked. You can write down in your notebook that like sodium, potassium, chloride are interlinked, calcium, magnesium and phosphorus, they three have a similar function to perform, which is maintaining the healthy bones. The most and what all food sources are there for magnesium? They are nuts. Nuts are rich source of magnesium. Oil seeds like sesame seeds, pulses, soybean, rajma, moat beans, they all are good source of magnesium. And even whole grains like wheat, pearl millet, which is known as a bajra in India, sorghum, which is called as a jowar, they all have a good amount of magnesium. And apart from that, seafood, especially shellfish, contains a very good amount of magnesium. So we are not going to discuss about the functions, but here I am telling you the food sources in which magnesiums are present. And like calcium and phosphorus, magnesium have same function, which is to maintain the healthy bones. Okay. Similarly, here is a slide which is giving you the functions of magnesium, which are same as for the calcium and phosphorus. You can read it down, you can note it down. I have already discussed these with you. So here we are ending with the unit 4. Now unit 5 is about the macronutrients. Again, it's iron, which is an important mineral for you. Iron required in very small amount of the body, therefore also called as a trace element. Okay, but it is very important because iron is required for maintaining the red blood cells in your body, and their deficiency leads to anemia. I have already talked about that. And here I have listed the sources of iron. Green leafy vegetables, especially the kale leaf and spinach leaf, they are, contains good amount of iron. Even the broccoli is a good source of iron. Egg yolk contains high amount of iron. So these are the sources which contains iron. And the another slides is also showing you the good source of iron rich foods. They are liver, meat, jaggery. Jaggery is being used in India uh, as a sweetener. They add jaggery in their sweet dishes because they are sweet in taste. So they are added to the desserts to make them sweet, and jaggery is a very good source of iron. So these are the food sources which are rich in iron. Now, what is the function of iron? I already told you that along with the folic acid, the iron supplementations are given during the pregnancy. Why? Because it helps in synthesizing the hemoglobin. Hemoglobin is heme plus globin. Heme is iron, globin is a protein. So you can break down this hemoglobin term. Heme plus globin. Heme is iron and globin is a protein. So in the body, iron is required for the synthesizing of hemoglobin, which is which helps you to carry the oxygen from the lungs to the tissue, and when we releases the carbon dioxide, they carries back this carbon dioxide from the tissues to the lungs, where again the carbon dioxide is being, filtered, and they they circulate this. This is a respiratory system. I'm telling you that when once the hemoglobin carries the oxygen from the lungs, a fresh oxygen, it will supply this oxygen to all the tissues, and the tissues will in back in revert they gives you carbon dioxide, and they uh, bring this carbon dioxide back to the lungs, where it will filter this carbon dioxide to the oxygen. So iron makes your blood red and healthy. Why? Because it supplies oxygen. Oxygen is very important for the blood, and it also helps in synthesizing the hemoglobin, which is basically the red blood cells. So this is the major function which iron performs in our body. I guess everybody can remember now, because I have discussed this in a very simpler manner. Uh, Now, what happens if the iron is not provided in the sufficient amount to the body? Anemia. This is the disease which can be seen in children and especially women's. As I told you, during pregnancy, the iron supplementation along with folic acid is given to the pregnant ladies, because anemia can lead to the uh, miscarriages in the pregnant women. And in children, anemia is seen because if they are malnourished, if their diet is poor in iron, they are not taking iron in good amount, then they become pale in color, and anemia happens to them. And anemia is a condition where they become tired, have a poor efficiency, and they are uh, behind the walls, like they are stunted, their growth is not uh, as like the normal child, and they become stunting is there, their height is not normal, and their weight is not maintained, their blood is not healthy, there is a lack of blood inside the body, and they become pale in color, and the deficiency is commonly seen in children and women. Then adolescent girls are also uh, prevalent to this anemia. Then, as I told you, if you are not having the right amount of oxygen in the tissue, then your working capacity will be decreased. So this is the another point which I have already discussed with you. You will be lethargic, you will get tired soon, and your work proficiency will be hampered. And person will appear pale in color because there will be lack of red blood cells inside the body, and you will become yellow in color. Your skin will be yellow in color, your eyes will be yellow in color. So this is all about the deficiency of iron. The next slide shows you the absorption of iron. The indigested iron gets absorbed from the upper part of the intestine. For all the minerals, here I'm saying this again and again, that for all the minerals, they are get absorbed in the intestine only. Then iron, as I told you, is present differently in different foodstuff. Some are, rich in iron, and some are poor in iron. And animal food, meat, poultry, egg yolk, they contains high amount of iron. But the iron which is present in plant sources like kale leaves, spinach leaves, broccoli, jaggery, they all are white vegetarian sources. The iron is high in them, but the bioavailability is low. What is bioavailability? Bioavailability means once you eat the iron rich food, how much of the iron is being absorbed in the body. That is called as bioavailability. You too have eaten the iron rich food, but your body has taken it all. No, some percentages of iron is being absorbed by the body. So when you eat animal food, the percentage is higher. The body takes iron in high amount. But when you take iron from the plant sources, like if you have eaten spinach, if you have eaten peanuts, which are its source of iron, and jaggery, then chana is also a rich source of iron. If you have eaten all those vegetarian sources, then the bioavailability will be lesser in comparison to the animal food. So its absorption depends on the variety of food you have eaten. Okay, and why the availability of iron is less in plant source? Because they have binders. There are substances present in vegetarian foods that bind the iron, and if they bind the iron, they won't be easily released inside the body in this simpler form. As I discussed with you yesterday also, the food has to be broken down into the simpler food material to being absorbed by the body. Like if you have eaten carbohydrate, the starches have to be broken down into the glucose units to get absorbed by the body. So when you eat, what happens to the plant source iron? When you eat them, the iron is not in the available form because there are certain binders. We call them inhibitors. Inhibitors are present that not releases the iron into the body. So in plant sources, certain substances are present which are called as inhibitor, and that is why it is always advisable to the human beings that have animal foods as much as you can if you want iron in good form. It but for vegetarians there are other ways by which they can improve the absorption of iron. What is that? It is the combination of iron having with the vitamin C rich foods. While discussing about the vitamin C, I already discussed that vitamin C function is to help in absorption of iron. So when you are having spinach, when you are having your food, when you are having your dinner, your lunch, you are always advisable to have a lemon with it, or to have amla in form of pickle, or in form of sabzi, in form of vegetarian curry you can have it. So it is always advisable to have a lemon with your lunch and dinner, because what happens when you add lemon, it will start improving the absorption of iron. So this is one way for the vegetarians to promote the absorption of iron. Now, this is all about the absorption of iron. We have another important mineral. This is called as iodine. Iodine is very important because it is required by our thyroid gland, which is present in the neck area. You can see in the picture, there is a picture in which a woman is shown with a normal thyroid gland, and there is another picture on the right hand side with a abnormal thyroid gland. So when you have a iodine in right amount, your thyroid gland will not be swollen. And if you are deficient in iodine, your body is deficient in iodine, then your thyroid gland, which is present in the neck region, it will swallow, and it will put on the weight around your neck area. So you must have seen this in some maybe patient, that their neck area is swollen. Why? What happens? Why it happens? Because they doesn't have a iodine, and they lead to a deficiency of iodine, and the deficiency is called as a goiter, which is mentioned in this slide only. You can see in the picture, below the picture it is written that the deficiency of iodine is called as a goiter, in which what happened, the thyroid gland gets swallowed, okay, and your neck region becomes enlarged, and it put on the weight around your neck area. Clear to all, I guess? Then how you can prevent the iodine deficiency? Anyone can tell me what strategy the government has adopted to stop this deficiency? Anyone can tell me from where we can get iodine? Is there anyone who can tell me from which source we can get the iodine? No one? Nobody knows about it?
Pardon, madam.
And we have all opportunities open. And most importantly now we are not lived down the phone.
Hello.
Here we work for SPA and diploma. So we are very blessed and thankful to Dr.
Hello.
Shilpa Dr. Satya Ravi. Just pushed us. And the dissertation we had done, it was more than half a PhD. It took about 1.5 years to do our dissertation. It was so meticulously done. And now we are also
Hello.
working as a
Hello. Madam, tell me.
and research counselor in. So we are from where this voice is coming? We are very thankful to Shiv Sarvata sir and Dr. Ravi ma'am from Nagpur. Thank you so much. And students, you just remember whoever are the students, if you is
You are audible, madam. No problem.
Yeah, am I audible to all the students? I'm asking you from where you get this iodine. Can anybody tell me? Yeah, Mohammed Sani.
You are audible, madam. Now I think you are not getting any voice from outside.
Am I audible to you, sir?
Yes, madam, you are audible. Please continue.
Okay, I have asked a question to the students that in which form you get the iodine. Anybody knows about it, or I shall continue with the presentation?
Dear
I guess
students, try to answer the questions being raised by the expert. Session should be interactive one. Then
hmm,
only it will be more interesting. You try to answer the question as much as you know. If it is wrong, there is no problem because everybody do not know everything. By interaction only, by listening only, you will be learning the knowledge. Please interact, say something, then madam will continue. Okay? From egg
say
and fish.
no if you guys doesn't know it, just simple say no. I don't. We don't know. I will be continuing otherwise. Okay. It feels that nobody knows about it. So let's start with that only. Okay. So sources of iodine. There are two sources. Uh, in India, we have launched a program where the salt which is available to all the consumer is iodized. They have, supplemented the salt with the iodine so that the supplementation can be done at a universal level, not at a smaller level. At a universal level in India, the salt has been supplemented, fortified with the iodine. Our salt is fortified with iodine. So from where we are getting iodine? We are getting iodine from our salt only. The salt which is available in the market is already fortified with the iodine. And apart from your salt, you can get the iodine from the agricultural products which are grown in the iodine rich soil, which again depends on the type of soil, type of crop farmer has been used. But at a universal level in India, we have salt which is being fortified with the iodine. Okay, so I guess now everybody knows, and if anyone asks you, do you know the source of iodine? Then please answer. Okay, I guess I have cleared this. Now we are moving forward to the unit 6, which is planning the balanced diet, and that is how you will be ending with the block 2 of your certificate program. So moving forward faster because we don't have enough time. So after the studying about the balanced diet, you will be able to answer what balanced diet is, how the foods are classified, what is recommended dietary intake, and what are the steps in by which you can involve in preparing a balanced diet. So quickly we are moving to the first slide of this unit. There we have where I have shown you what balanced diet is. Balanced diet is nothing but uh, a diet where different type of foods are, you know added in such quantities, in such proportions, that they are adequately meet the requirement of a men or a woman. Okay, a particular definition you can note down from here or from the material which is given to you. I am just explaining in the simpler form. Okay, a balanced diet first of all consists different type of food items, because you need cereals also, you need uh, fruits also, vegetables also, fats also, and you need nuts also. So a combination of all these food groups is called as a balanced diet. And here is a graph which is showing you the different percentages at which they are required. Like maximum amount of food group which is required in your balanced diet is fruits and vegetable, that is about 40%. What you should include in your diet is vegetables and fruits. 25% is your bread and whatever you call it, wheat and rice. Then 25% is your meat and meat-free products, and 10% is your other fruits like nuts, oils, fats and proteins. Okay, so what balanced diet is? Balanced diet is nothing but it is a diet that contains different type of food, okay, that meets the need of nutrients, provide you the enough energy, enough protein, enough carbohydrate, and enough fat to perform your day to day life. Fine. Now moving forward, how you plan a balanced diet? There are two uh, basic rules, basic principles by which you can plan your balanced diet. A is classification based on sources, and B is classification of food based on function. So these two principles are used while uh, you know planning your meal. Okay, what is classification based on source? How you can include that in your balanced diet? So we will be discussing that in the another slide. Classification based on sources, I have already talked about that you must be having food from all these food sources. You have a cereal also in your plate. You must have a pulse in your plate, some nuts in your plate, green leafy vegetables, roots vegetable, milk and milk product, sugar and jaggery should be there, fats and oil should be there. And if you're non-vegetarian, then protein-rich food like fish, meat, poultry, eggs should be there. And you have to have some condiments and spices also. In India, we use lot of condiments and spices while cooking our foods, because they also perform certain functions which we will not go in detail, but yes, you need to have some spices and condiments. In that, we I would like to quote an example of cloves. Clove is a very important because it has a therapeutic value. It is good for our body, so you can add cloves, you can have turmeric. Turmeric is also therapeutic in nature, and it is a spice which we use in India commonly. So you have to pick food from each of these food groups while planning your meal. Now second is classification of food based on functions. As I discussed with you in my yesterday's lecture, we have a three basic groups from which we have to choose our food. One is energy giving food, another is body building food, then we have a protective and regulatory food. If you remember, I will not go in detail because we have a less time, and I have already talked that in my yesterday's lecture. What are energy giving food, what are body building food, what are protective food, you already know about that. So in next slide, for your better understanding, I have given a slide where you can see what energy foods are there, what body building foods are there, and what are protective food. We have already discussed these three in our yesterday lectures. Just to recall it, I have added a slide over here. So while planning a meal, while planning a balanced diet, balanced meal, you have to add the food from all these three categories. You must have a uh, ingredient which comes from energy giving food in your plate, one from bodybuilding food, and you must add something from protective food also. Then only your diet will be a balanced diet. I guess this is clear and very well you can understand from the slide. Now moving forward to use of recommended dietary intake in planning balanced diet. I have talked yesterday also that okay, this nutrient have to be, meet your RDA, your recommended dietary allowances. What is that? Why I'm talking about RDAs? Why they are important? So here is a simple definition I have quoted, that recommended dietary intake is the amount of nutrients which are required by the body to perform the activity. Actual definition you can take up from the study material and from the slides also. But for in a simple language, I'm just telling you that it is the amount of nutrients which is required to meet the uh, requirement of the body. If you have to perform a certain function, then nutrients have to be consumed in a perfect amount. You can say as a quantified amount, which are given in a table. In India, we have a committee that have, quantify the measurement of each category, like how much of carbohydrate is required for a man at a certain age, for women, for infant, for adolescent girl. We have a different RDAs available for all the age groups, uh, uh, and for the different sex also, like for women and for men, the RDAs are different because their physical endurance, because their appearance, their weight, they all are different. So according to that, RDAs are being decided by the committee. Then, as I told you, the recommended dietary intakes for adults are based on sex, age, body size, and activity level. Like I have shown you a picture where reference women and a reference man is given. The age is 20 to 39 years and weight is 60 kg. So this is the ideal weight that a man has to maintain when he is in a age of 20 to 39 years, and a woman should weight like 50 kgs, not below than that. Otherwise, the woman will be called as a underweight. So a reference man and a reference woman is given over here uh, according to their weight, according to their activity level, according to their body size. The RDAs has to be decided. But for a reference man, weight should be 60 kg, and for a reference woman, a weight should be 50 kg. Then I will be talking about the principles which are important while planning a balanced meal. Okay, so while planning a balanced meal, you have to keep in mind the three important principles. What are these? You can see in the slide, there are 3 points I have given: individual specific, region specific, and income specific. So when you are planning a diet for a man, like if I give you, okay, plan a meal for me, then you have to ask me these three questions. Individual specific means my age and my sex. Every individual has a different age, and male and female matters because RDAs are different for male and female. In case of adult, it is also specify to uh, you know give your activity level, like there are three different activity levels: sedentary, moderate, or heavy. What is sedentary? Sedentary is a light kind of a work. If you are not performing rigorous activity in your daily life, then you fall under a sedentary work lifestyle. For example, a typist or a clerk or even a teacher, what they are not performing vigorously in a day. They are sitting on a table and they are doing their work. They are sitting in a chair and they have a table and they are performing the activity. So they falls under the sedentary work lifestyle. And it would be different, the diet will be different for heavy worker like laborers. They perform a heavy duty in a day, they need lot of energy, so their carbohydrate requirement will be large in comparison to the sedentary workers. So according to their activity level, a balanced diet have to be you know, you have to keep in mind the activity level while planning a diet for anyone. So it is very important that you should know about the individual before you are planning a meal for anyone. Then age is also important. Infant will require carbohydrate, protein and fat in different amount in comparison to the adult, and a men will require different amount than a woman. So these are the individual specific points which you have to keep in mind while planning a diet. Next, moving on to the region specific. Region specific means uh, the uh, crops available in India must be different from your country. So region specific ingredients you have to use. Like it will be impractical if I'm saying, okay, in India potato is being used in a high amount. You also add potato in your diet. So this is something stupid. You must be having something else in your daily life at a large level. So mm, uh, region specific diets has to be there. It's not like you are listing some ingredients which are not available in that country or which are not available in that city. So region specific ingredients have to be used. Then lastly, about the income. If my income is more, I can afford more proteins, like I can afford eggs in my daily diet. I can afford milk, two glasses of milk. Then my diet may be different from that who cannot afford protein rich foods, one who cannot afford the expensive fruits. So income is a very important point. So before managing a diet, before preparing a meal for a individual, you have to keep these 3 points in your mind. First, the individual, what is the age, what is the sex, what is the activity level, and region. You have to see where the person is living, which ingredients are available over there, and lastly, what is the income of that person. Will he be able to afford what we are listing in our balanced diet? So these 3 principles are important.
My interest in
La-
psychiatry and mind health
my last
was
slide is about the
like
steps in planning the balanced diet, and I have already discussed these in the slides. You all can read that.
in psychiatry
They
to
are
10
nothing
years for
but
only
to identify the age, sex, and activity level, then consult about the protein and energy requirement, then decide the food groups, which food you will be choosing from the energy giving, protecting giving, and bodybuilding foods, and then finally the amounts of meal they want, like 3 meals, 2 meals, or 1 meal in a day. So these are the 7 steps you can read from your course material also, and you can read it down from the slide also.
which
So this is all about the today's presentation. I guess I have made it very clear what about the vitamins, how minerals act in our body, how they are being absorbed in our body.
people think which
Then
I
what is a balanced diet?
because of
How you can prepare a balanced diet? What are the factors that can affect, you know, preparing your balanced diet? And lastly, there are the 7 steps that are required to keep in mind while planning a balanced diet. So
Thank
thank
you,
you.
madam. Thank you. Thank you very much for a wonderful session. On
Thank
behalf
you.
of all the students from IGNO side, I thank you very much. Thank you.
Thank you so much. Thank you for all listening patiently to me. Thank you so much.